What's up, guys? Dr. Mo here. So, telemedicine has become a whole new beast. One of the things that I find good about telemedicine, one of the things I love about telemedicine is that I can practice it from anywhere, right? I mean, the opportunity of being in this lovely apartment, being at a cafe, being at a co-working space, being in a different state, being in another country, and being able to do video telemedicines, phone telemedicine, asynchronous telemedicine is incredible. So that part I love, and the income is good, and the work is good, and I feel like for the most part I'm making a difference in the patients' lives, right? But one of the things that is really difficult is telemedicine is becoming more and more strict as far as what guidelines you should follow, what things you should do, what things you shouldn't do. And all of that piles up and sort of adds itself on top of each other and creates a lot of like anxiety and stress in me when I'm doing telemedicine. One of the telemedicine platforms that I do work for, there are so many different categories of diseases and conditions, and based on certain criteria, they're very explicit that you cannot, for no reason, with a patient above this age group for this particular back pain, can you prescribe this medicine or any medicine? You must refer them to the ER. And the issue at hand is that, number one, I'm never going to remember all of those details. And number two, if I do prescribe a medicine, the system is not going to just flag me. So there's no secondary method for me to regulate myself and make sure that I'm following all the guidelines and criteria that the telemedicine platform has set out. This creates a lot of anxiety. So I decided to share something that I've always done when it comes to telemedicine. I use it as a way to essentially screen patients. What I mean by that is telemedicine essentially is a way for the patient to get access to the physician in the easiest way possible. And for me, that's sort of like getting triage. Should I go to the ER? Should I follow up with my primary care doctor? Can I wait a few more weeks before doing something or going to a specialist? Or is there a medicine I can try over the counter? And so I made 10 bullet points that I'm kind of going to go over to give you guys a sense of like the way I do it, and it drastically decreases my stress level. When it comes to things like back pain and UTIs and pregnancies and vision changes and eye redness, I understand there are certain things that are totally risky, right? If somebody has uveitis, if somebody has acute angle glaucoma, if somebody has pyelonephritis in pregnancy, if somebody has cauda syndrome or some sort of other serious medical condition of the back. But the problem is that most of the time, if we're trying to capture those and diagnose those through telemedicine, it's just difficult. And so I think the better thing to do is to protect yourself as a physician and say that, hey, I'm going to educate the patient. I'm going to give them some information and let them sort of decide what to do next. So I made these bullet points that I think will be helpful. Kind of take it with a grain of salt, but this is the way I've practiced telemedicine for so many years now. And I think it's been helpful, and I feel like it's protective. The number one thing that I always want to say is be energetic. When you first go and start that conversation with the patient, hi, this is Dr. Mo. Well, I would say, hi, this is Dr. Ashori, and sorry to keep you waiting. I read here that you have this, this, and this, and I want to hear more. So that's kind of the bullet point number 2, is make sure that the patient gets the feeling, gets the sense that you read something about them, that you know what they're here for. So my routine is always, hi, this is Dr. Ashori. Just to let you know, I'm a board certified family medicine physician. I am licensed in the state of California, where you are. And I wanted to let you know that I read a little bit about this UTI, and it looks like it's been going on for 3 days, but I just kind of want to hear from you. Give me as much detail as you can. Tell me what's going on. Then I shut up. So that's point number 3. Don't interrupt. Give them the floor. And the reason for that is some patients have had a lot of anxiety coming up to making this appointment, and they're sort of worried that they're not going to be able to get something out that they want to say because they know they're going to get interrupted, or maybe they're rushed. So I just let them talk. And sometimes they'll say just like one sentence and then they stop, and you're like, could you tell me more? And you mentioned the burning. Tell me more about that. Anything where you're just completely silent and calm. You're coming in with that energy of like, hi, this is Dr. Ashori, and I read, I'm board certified in California. But then you want to just stop. Like, hey, there's going to be this time for you to speak and there's going to be my time. And I think there is this other part too that sadly telemedicine companies have decided to pay us per patient, which is generally is not a smart thing to do in my opinion, because unfortunately you're going to incentivize doctors to then do it as fast as possible. And that's the other thing. These 10 bullet points that I've made also kind of help me perform telemedicine very, very quickly, because I get through patients very fast, and you'll see why as I go through them. So the other part is I want to know what is their main fear, because sometimes you'll talk to a patient forever and then they're like, well, I just need a doctor's note. And you're like, holy shit, if you had just told me that from the beginning, we wouldn't be having this entire conversation where you're making up all these things about your situation and I'm asking all these questions because I'm thinking about a zebra. So, hey, thanks for that information. That was really helpful. What were you hoping to get out of this visit? What is it that you really needed? What was your main fear? What were you really, really worried about? And say that with sincerity, like really, elevate your voice and lower your voice. And like it's hard because when you don't have this video or face-to-face interaction with a patient, it's hard to convey to them that you really care and that you really want to help them, but that you also know when something that's benign and the patient's overblowing it, that you will call bullshit on it, and like you can reassure them based on that information. So sometimes using your voice can be really helpful to, I think, convey that and make the patient understand that. So I think getting to the bottom of that is really critical. Like, what is it that you really need? What were you really hoping for? I just need antibiotics for a sinus infection. Great. So now we can go into the details. And for me, that's what have you tried? What do they think it is? That's okay, they told me it's probably a sinus infection, or they're like, well, I just kind of wanted to get your opinion as to what it is. Okay, what do you think it is? Based on the symptoms that you've had, what do you think it is? And what have you tried? What have you tried over the counter? So I'm basically asking some more general questions to them because I want to know more. I want to get them involved in their healthcare. I want them to start thinking about their condition as well, so that I'm not this one-way channel of giving them a bunch of information. Number one, this empowers the patient. Number two, they get a buy-in into their disease, and then they all of a sudden understand that they have choices and they can decide what it is that they can do. And number three, it puts me a little bit further away from the liability issue, because now that you're more involved, we're both decision makers here. I give you some advice and you get to give me some feedback and we can decide together, so it's not just one or the other, where the patient feels like, great, this doctor is going to have all the decision-making power and I have no power, and it doesn't feel good. It puts them in a bad situation. What would they like you to do? Oh, okay, all right. Well, that's kind of part of it, right? Like, hey, like, what is it you want me to, what would, sometimes in those more complicated cases, right? Like the easy ones are easy. You're probably not even going to go this far down the list, but there's cases where you're like, I don't really understand. What is a patient? What could I do that you think would help your case out? Honestly, I just want you to reassure me that it's not breast cancer. Oh shit, breast cancer. Okay, well, we can talk about that. Or like, I just need a referral to a psychiatrist, or I just need to know where to go to have this abortion done. Okay, great. So now you get to the nitty gritty, like what would you want me to do? What is it that you think I can do, or what could I do for you that you think would help your situation? And then this entire time, I'm trying to think out loud. Whatever's in your mind, spit it out. Why? Because when you think out loud, you're actually educating the patient. When you're educating the patient is going to recognize that you care. Okay, so let's think about this. So you mentioned that you have some burning when you pee, and you've had this before, and it was a UTI, but this doesn't feel like a UTI. And of course, I understand you could be worried about like a sexually transmitted disease, but let's think, what else could there be? Interstitial cystitis, what's now called painful bladder syndrome. It could be maybe a little bit of urethral irritation. Maybe it's a little bit of vaginitis, not from an STD. So there's all these things. And the reason I'm kind of mentioning all this to you is because all of these are certain possibilities. And from what you've said, it's really difficult to know exactly what it is. Now, if I had a urine test, I probably could tell you. If I did a pelvic exam, I probably could tell you if the cervix is inflamed or not, but I don't have that information on me. So let's think together and come up with a plan. Beautiful. You just shared your thought process, your differential diagnosis, what you would do if you were in the clinic, letting them know, hey, there is a limitation here on telemedicine. Patients don't sometimes realize that. They think that you can diagnose them on telemedicine. And just telling them, hey, look, I'm not there to do a good neurological exam on you. So the fact that you had this funky sensation on the right side of your head, I mean, if I was there, I would do a full cranial nerve exam, where I would check all the nerves in your head and face and brain. And if they were all normal, great, I wouldn't really be worried about anything like a stroke. But I'm not there, so that kind of makes it difficult, right? You're just sharing that out loud. The next step for me, I think, after this education portion and me sharing all that information, telling them my differential diagnosis, is I want to recommend home remedies. I always want to recommend home remedies because it empowers the patient. When the patient feels empowered, they feel like they're in charge. They feel like they have the autonomy to decide what to do next with their body. And I think that's such an important thing. And if nothing else, believe me, it'll make the interaction much easier. Okay, so your foreskin's a little bit tight. When you pull it back, you're seeing all those cracks. I saw the photo. It's really difficult to tell what it is. It looks like you can still pull it back all the way. So I don't think it's phimosis or paraphimosis, which is something you may have come across online. But it is so irritated and you really don't want to go into the urgent care. I totally understand you don't want this. But me prescribing an antibiotic for this, I don't know if that would help because it's not clear that there's an infection going on. There's a couple of things that you could do. You could apply a little bit of hydrocortisone cream, sometimes called Cordate. I don't know if you're familiar with it. A little bit of hydrocortisone cream for 2 or 3 days. That might decrease the inflammation. And then trying to keep the area as dry as possible when the urine comes out. Right, so you're just kind of telling them what they could try at home. Maybe do this. Oh, you could do a sinus wash. You could put a little bit of hydrocortisone cream on there. You could use a little bit of coconut oil. You're having some pain during intercourse. You could try vaginal dilator. You could do this. You could do that. So just discussing some things that they could do, and then you can say, but sometimes those things don't work. And if they don't work, usually what I do in my practice. So I always let them know, like, hey, this is telemedicine. But in my practice, in my physical practice, usually what I do is this, this, and this. And so I'm just kind of telling them what they could try to do. And they might say, I've already done all that. Great, so we can go to the next step. So at that time, I always want to ask, what is it that we have concluded so far? Okay, so it looks like this is probably, let's say, bacterial sinus infection, and you're probably going to benefit from an antibiotic. But I'll tell you, if I give you an antibiotic right now, chances are you might need an antibiotic in the future. There's all these other side effects, yeast infection, all that stuff. Why don't we have you try something like do the sinus wash, do this and do that, and I'll give you this as a backup. And if you don't get better, you could always use it, So you could offer something for them, like, or maybe why don't I book an appointment for you? Certain platforms have that. Why don't I book an appointment for you in like 3 days, and then we follow up together and see how you're doing? Or why don't you give this a try? And then I'll give you the script for this other medication, and only if you don't get better, you can get it filled. And these are great ways to just get the patient involved. Tell them that you're doing something for them. Like, look, I'll give you a work note, I'll give you this, I'll give you that. And then the patient feels like, okay, this doctor cares. He or she is trying to do something for me, but I understand that they're not going to do everything for me. And I think that's one of the things that with the difficult patients is really good to do. Like, what do you mean you can't refill my pain medicine? What do you mean you can't give me a muscle relaxer? What do you mean you can't give me my anxiety medicine? Or why can't you give me antibiotics? Well, the reason is it could be this or that, but I could post-date it for you in like 2 or 3 days, and if you don't get better, you could try it. And at the very end, I always say, look, if this or this or this happens, that's when you should go to the ER or go to the urgent care. If I give a medicine, I say, like, look, any medicine can have a side effect. So for any side effect, you should just contact me again. Just get back to us. Go to a walk-in clinic, go to an urgent care. And I ask them, is there anything else you can think of? Is there anything else that's on your mind? Anything that I didn't address properly? You're worried that's going to just open up this entire new conversation. And it might. If you didn't do a good job, if I haven't done a good job of really closing that loop, then asking this question is actually going to open the conversation back up. And that's understandable because the patient actually wasn't satisfied when they left it. You might think that, I did the right job, but they might give you a 1-star review. They might complain about you and write something shitty about you online. So in fact, asking this question is going to save you a lot of headache. Just because you're going to make $23 for this patient and you only spend 6 minutes, but it's going to haunt you for the next 3 years, is it worth it? I don't think so. So ask that question and say, hey, listen, is there anything else? I just wanted to make sure that we addressed everything. I feel like we discussed the coughing pretty well. Hopefully you can sleep good today. And we discussed what you should do if it doesn't get better. But is there anything else you can think of? Is there anything else you think I can do that would help you out? No, doctor, thank you. Like that sounds good. No, I'll really try that. But, honestly, like, I just don't want it to be a pneumonia or bronchitis. No, I know how you feel. I totally understand. Hopefully we'll see. It's just a matter of time at this point. We got to kind of watch this. It wouldn't be appropriate for us to just attack it aggressively. Okay, yeah, no, I understand. So those are my 10 bullet points, guys. I hope this helps. Kind of the concept again is to triage the patient. Can they wait? Do they need to go to the ER? Do they need immediate treatment by me? Can they try something at home? Educate them, empower them, give them the options. And that's it. And that's going to make that visit so much easier and so much speedier. Hope this helps. If you have any questions, check out the website, digitalnomadphysician.com, or email me, drmo.mo@digitalnomadphysician.com. Take care, guys.